Welcome, everyone, to this week's edition of Just Ask Freeman with Freeman Owen Jr. Everyone knows Freeman in the whole D.C. and Maryland area. He's in many states, but we are so happy he is here. He is, of course, President and CEO of Financial Sources, Inc. He has been doing this for over 45 years, married for more than 50 years, grandchildren, great-grandchildren. He is such a staple of this wonderful community. And I am Rebecca Powers. I'm so happy to be his host each week. I was an investigative reporter for many years, an Emmy Award-winning reporter, also a news anchor, and I am so honored to be here. I consider myself a consumer advocate now, and I am so happy. I've learned so much from you, Freeman. You know, so many people don't have a written plan, and that's really what you focus on, is that relationship, that personal knowing someone of what they truly need. Mm-hmm. When someone loses their spouse,
wow, yeah,
that is so tough, but you are there to hold their hand, and you've got that plan. They know where to go next.
Yeah, they come to me. There's the loss of a spouse. We review the inventory that was taken prior to the death of the spouse.
Yeah.
We looked at, we understand the pension benefits as well. So let's look at the living aspect that leads up to the preparation for and the comfort of the surviving spouse, okay? Financial inventory. I think it's a good idea to have written down all the different sources of income. Life insurance, if you have the 401k, or if you have IRAs, you have savings accounts, money market accounts, mutual funds and stocks and so on. You have that inventory, and it should be available. I mentioned that when we start our tax-efficient plan.
Yeah.
Understanding pension benefits. There have been clients that thought they had a survivor benefit of the pension, of the husband's pension or the wife's pension, and they did not know there were no survivor benefits. Then, what I've informed them too, if they have not retired, and they say, well, my wife will take care of this, she'll get my pension and so on. No, you have to pay for that pension, all right? And it's a tax, the pension, or you're getting a certain percentage of your spouse's pension, you have to pay, and it's taxable. Let me do a hypothetical. You got a person there that the husband or wife has earned $100,000 plus. When the spouses say, well, I'd like to have my spouse to receive 25% or 50% of my pension. Okay, how much does that cost?
Yeah.
$500 a month? $600 a month? Let's make it simple. Let's get 25% of that $100,000 salary, or the pension, I should say, and pay $500 a month for it. Now, 12 months, $25K is the pension amount, which happens to be taxable, but we're paying $300 to $500 a month for, that's the cost of the survivor benefit. Multiply that by 12, that's $6,000, $500 a month per year. Let's go out 10 years, $60K. The recipient or the beneficiary of the survivor benefit dies. The husband or wife is still around. So what we did, we spent 10 years, I'm gonna make it 10 years, times, what was that, $6,000. That's $60,000 that did not work well for the participant who has the pension, and it definitely did not work well for the spouse that passed. So you spend $60K taxable,
right?
If that pension is receiving that benefit for $25,000, which is a taxable amount. Well, there's an alternative, and better preparedness for wealth to be transferred.
Yeah.
All right.
What's the better way?
The better way is to, what we mentioned in a previous show, to have an indexed universal life program and get a percentage of that that cash value or the death benefit, which just happen to be tax-free.
Yeah, and we said it before, and it's so important to understand, any type of annuity, any type of policy is a contract with an insurance company. And you pointed this out last week. It's so true. A pension, any pension you've ever heard of with any major company, is an annuity. So don't let the annuity word scare you. There are variable annuities, and you've even said those are bad. Stay away from those. And if you have a variable, definitely just ask Freeman, because he will switch you to a different one. Another great thing about annuities, Freeman, is that you don't have to do a medical exam, right? A lot of people say, I don't want I don't want to go do a medical exam. Talk about that. That's big.
It is. And the name of the game is that you purchase that annuity.
Yes.
There is no, now, there is one factor in which we consider when there's a purchase of an annuity. Suitability.
Right.
Remember I told you the gentleman last week, what he did was he wanted to separate from service, good income, but the thing is he had a tax qualified plan that he wanted to roll over, and I suggested no, because you have too much
income.
Existing debt.
Oh, debt. Gotcha.
He had that credit card debt and some other debt, and I didn't feel comfortable with that, and plus he would not have been suitable, because I would not want him to use his IRA, the employer-sponsored retirement account that had been rolled into the IRA or Roth conversion, as an ATM machine.
Amen. Because then you compound your loss, but it's better to have a policy where you'll have growing, guaranteed lifetime income. Or as you said, IUL, Universal Life. That's another great one.
That's right. And so now, no, there is no medical requirements for that fixed annuity or fixed indexed annuity that I utilize, or either one of the other type of annuities that I use, is make sure that you can bridge the gap between an earlier age than the full retirement age benefit that you would receive at age 67. That's another way to use annuities, to bridge that gap and then turn on the Social Security benefit, which usually is higher than the income, for, let's say, from age 62 to age 67. Now, the reason I mention that is that you have to understand Social Security benefits. Now, put it this way, if both spouses are alive, there may be a spousal benefit of up to 50% of the working spouse, even if that spouse is not, the spouse receiving the benefit is not working. That's a good thing. Here's what I've seen and heard from individuals that come to me and they've seen the show. Freeman, I'd like to get a Social Security report as well as that written, the written plan that you have that is really tax efficient. You talk about it all the time, but you also mention how to get your Social Security benefits, how to avoid costly mistakes, and how to maximize those benefits. Well, simple. You got to understand them. If a person decides that they wish to, now I'm going to kind of, this one lady said to me, came to me, she says, Freeman, here's what my girlfriends and my coworkers, now I told them, I said, now, those are your pseudo advisors. and her voice went, it sounded like this. Her girlfriends told her, girl, now you're only 62. Get your benefits because you might not live to age 67. Now, we don't know our date of death.
Right.
I told her, I said, now, a lot of times our friends and relatives and coworkers, they give us advice on Social Security benefits, on how to participate or how to get those benefits, but they don't know the consequences of receiving them prematurely.
Exactly.
So I explained to her the opportunity to get her full retirement age benefits, and also explained to her that there's caps. There's a max on the amount of the Social Security benefit that you receive, Rebecca, if you are working, and there are penalties. So again, if you really want to know how to apply for your Social Security benefits, understand pension benefits and how they work. We're going to talk about
tax efficiency is the
plans.
big one.
What you do, Just Ask Freeman. That is, claim your spot. There's a QR code right there. Claim your spot and get your tax efficient plan. And like you said, Rebecca, the big box, move away from the big boxes. I'll make it plural, the big stack of boxes there. And get someone, have a person that looks out for your best interest. Just Ask Freeman. Call us at 833-414-7233, SAFE. And you can see I'm serving Maryland, Virginia, and the Washington, D.C. metropolitan area for over 45 years. QR code is right there. Get your tax-efficient plan. And if you got $250,000, $500,000, $1 million or so in income-producing assets, we'll design your tax-efficient plan. We'll take care of your Social Security report so that you avoid costly mistakes. You will have an advisor that looks out for your best interests, and I know you have your friends and relatives and your co-workers that will give you advice, but they are unaware of the consequences of that advice that could lead you
down the wrong road.
Wrong road. So again, Just Ask Freeman. Call us at 833-414-7233, SAFE.
And we'll be right back. Stay with us.
Righty. I focus in on making sure that folks have emergency funds, credit card debt taken care of, no big ticket items to purchase on this journey. I ask them about their health. What role will they play? Do you have siblings? Do you have dependent children? I've had breakout workshops, especially for the young people, so they have financial literacy as they approach even for college. I used to do dinner seminars. I'd invite existing clients to bring people, think about their birthdays and so on. Just people want to know that you are concerned about their best interest, and that works well. It's very, very enjoyable type of work that you can do. And these folks prosper with just a little bit of adjustment to their retirement planning.
Welcome back to Just Ask Freeman. So many of us are retiring soon, and how do we know if we have enough money? You are not just a number. You are a very special person with your own special circumstances. That's why it is so important for you to have a very personal plan just for you. We were talking about Social Security. First of all, it was never meant to be taxed. It is.
It is.
It can put you in a higher tax bracket, which can hurt you. There are so many things you need to be prepared for. Once it's written down, you sleep well at night, don't you?
Exactly.
Let's talk about health care expenses and long-term care, because that's something that you really hone in on to make sure people are prepared for anything.
See, when you're in preparation for a lost spouse, we have to look at the harsh reality of that. One day, maybe both and one spouse will be left. So there should be preparation, inventory. Financial inventory, understand the pension benefits as we mentioned, understand Social Security benefits as well, understanding health insurance availability. Good example. Let's say, and this has occurred, where one spouse is older and is ready for Medicare at age 65, and you got a younger spouse. Now, while the spouse who is 65 is working, has to apply for what we call Medicare Part A.
Okay.
Now, if they
that's the basic.
That's the basic hospital stay. But the thing is, suppose the spouse who's 65 separates from service, goes into Medicare. What happens to the family plan while he was employed at some institution or wherever he's working?
Good question.
That family plan, where the husband or the wife was on, the kids, slides right off because now he's eligible for Medicare. So it's very, very important to check health insurance availability, whether or not that health care is portable, different types of insurance companies that, and the employer allows for the employee to take insurance policies with them. But you have to be cognizant of Medicare could play a big part of that. Long-term care insurance. Now, that costs a lot of money.
Yeah.
It costs a significant amount. That's why I mentioned there are fixed index annuities and other annuities that have long-term care or critical care as hybrid riders. Life insurance. That's why I said it supplements and protects retirement income. See how I rolled on out of that?
I know your pin just rolled off
right
the
off
desk.
the
I love
desk.
live television. You handled that well, sir.
Yes, indeed.
Yeah, but again, I just go back to that, I call it the P word, the plan, the plan, the plan. Do you have a plan? It's so nice. I can take my binder off my shelf and look at everything going on till I'm 100 years old. If my husband passes first, this is what happens, and vice versa. With the long-term care and the health care, there are sometimes things that the rider, what if you don't use the long-term care, I guess? What happens then?
Now, there are companies that offer the opportunity to have a cash accumulation.
Gotcha, good.
And the long-term care, and it's like use it or use it.
Good.
Now, usually long-term care happens like this. I've seen it over the years, whereas I used to do for every other product, I would add long-term care policy to it. Now, it was either use it or lose it. Now, what I'm saying is, suppose you, just as you mentioned, suppose you lived to 95 and you never had to use long-term care. That means you paid this premium all those years to no avail. You didn't use it. I found some companies, but has been approved in Virginia and I think in Washington, D.C., where you use it or use it. That means there's cash available that will create lifetime income, or you can use the long-term care benefit, and there's a lot of benefits to it.
Good.
So that's why I said I do my due diligence to look out for your best interests, to find those companies that work in your best interest and provide the safety, the security, and meet your particular needs. Because if you don't use it, in most companies say, well, pay all that premium, you lose it.
That's what I thought. That's what I've heard.
But not where there's a couple of companies I know of that will provide use it or use it. That means there's cash there that has accumulated at a nice interest rate. And you say, well, I'll use that. I didn't have to use my long-term care benefit.
Which is fantastic.
So you have the options there.
Good.
I really appreciate that company that we've got to get it approved in certain areas in the Washington metropolitan.
But they saw the need and they're doing it. All right, let's give that quick phone number. We need to take a very, very short break. When you come in, it is a warm conversation, a cup of coffee, an hour to get to know each other. It is no sales pitch. It is no high pressure. And it might be just to look at what's going on and you may be right on track. And that happens, doesn't it?
And what we need to do, just ask Freeman. Claim your spot. QR code is there. Or give us a call at 833-414-7233. 833-414-7233. Just Ask Freeman. Get your tax-efficient plan, Social Security report. Get an advisor that's looking out for your best interest. I've said this, you have an advisor, not scuffling and scraping. Buy or die. Take the time. And folks, my clients can tell that I look out for your best interest. Just ask Freeman. Call us at 833-414-SAFE. Or hit that QR code right there. Schedule a complimentary consultation. And we're going to leave the box until you have a tax-efficient plan, well-written. folks who are already clients, you see me hand you your portfolio and we review it. And we stay on track on an annual basis to look out for your best interest. We do annual reviews. You don't have an advisor just go away. Like one of the clients says, well, I haven't seen my financial planner in 15 years.
Yep.
Well, a lot of things change over that 15-year period. A lot of things, healthcare, your health,
the world,
period, your personal, you have children, grandchildren, or whatever. You have a person that does your annual reviews, and I've said this to one of my clients the other day. He's doing very well with his assets that we put together. Number one, my clients sleep well at night. But when they wanted to touch base with me, I said, well, if you sneeze, I got the Kleenex. I got it right here for you. Just call us at 833-414-SAFE, 833-414-7233. Just ask Freeman and get your financial needs taken care of and your concerns for your retirement.
And it just takes one phone call. Make that call during this quick break.
We're frequently asked where we think tax rates are headed. Most experts agree tax rates will eventually have to go up as our federal debt increases. Without any changes, the government's current plan is set to expire in 2025. Every penny counts, especially in your retirement. Is your current plan efficient and optimized to reduce your tax obligation? Contact us today. Just Ask Freeman. For a complimentary review, reach us at 833-414-7233.
Timing. All right, welcome back. We were just talking during that quick break. We're talking so much about health care because it's incredibly important. If you take Social Security too early or too late, you can hurt yourself. Same thing with health care. If you do the wrong Medicare plans, there's A, there's B, there's putting you in a higher tax bracket, taxing you more. Let's talk about the timing of when you do all these things. It's not a set it and forget it. It is a beautiful dance of perfect timing.
Yeah, and the timing of this health care, as we were talking about in the earlier segment where we're preparing for Medicare, I've had this question asked. Freeman, you talk about Medicare. What if I retire at 60? What can I do because I'm not eligible for Medicare?
Yeah.
Well, you have to get you some type of health care or health insurance policy. Now, you don't want, and one time you may have had health care benefits while you're working, but when you separate and you're far away from 65, there's a health insurance called COBRA, which is very, very expensive, and it only lasts 18 months. So what we have to do is get some type of health care coverage. So maybe a Medigap, such as, I won't promote their names, but there are insurance companies that offer insurance for you that will carry you right into age 65 so you can get your Medicare Part A, which is hospital stay. Then there's Medicare Part B, okay? It was $170 and some change back in 2022. Now it's $174.70 to begin with. Here is where, I'm going to try to make this brief because we got a few minutes. You separate from service and you bring your health coverage with you. Now you're eligible for Medicare Part B. Here's your primary, here's your Medicare Part B.
Okay.
Medicare Part B becomes your primary, and your the insurance that is portable is your secondary. So A, B, and your A and B takes care of 80%, and your insurance that was portable that you brought with you takes care of 20%. Then you get what we call what they call this now, a prescription card to take care. So now we've taken care of 80% of our health care expenses, A and B. 20% takes care of with our secondary coverage, and then D takes care of
the prescription
prescriptions.
cost.
And there's a competitive product called Medicare Advantage. Now, I don't have time to go through all that, but still, we had to select the healthcare benefits that are best for you. Now, I talked about the Medicare supplement.
Yeah. You had mentioned a few months ago, and I remember this, that another thing that you've taught me, Freeman, is that when you're a high earner and you pick certain Medicare, they will tax the heck out of you, put you in a higher bracket. So it's extremely important to ask Freeman.
That's it. I want you to ask me. Just ask Freeman. There is an additional cost to Medicare Part B if you're a high-income earner, and it's called IRMAA. Now, I've experienced that, and many of my clients who are high-income earners pay an additional cost above that $174 a month. That's there, and that's what you have to pay for. Not only is the cost, does it increase the cost of the participant who's getting Medicare Part B, but what if your wife is getting Medicare Part B? Both, for both husband and wife, there's an increase, a significant increase called IRMAA. It's additional, my memory won't serve me at this point on that acronym for IRMAA.
Yeah.
But I'll have that for you for the next show.
We know that Irma can be a not very nice aunt because we don't know if we like her.
It's not. Irma is not nice. It's more taxes
More
on
money,
you.
more money.
And you can expect that. So what we'll do is plan so that we'll know whether or not Irma impacts your health care plan.
Yeah.
All right.
Well, you're out of time, and it is hard to believe. We love you so much, and we really appreciate you. Any question you have, always just ask Freeman. There's the number again, 833-414-7233. 7233 spells safe, because for you to have nice, sweet dreams every night and not worry, it is all about your safety. Final 30 seconds. I'm going to give you this final say, sir.
Well, I tell you what, if you are concerned about sleeping well at night, and having a real good retirement plan in place, just ask Freeman. There's that the QR code is there. Schedule a complimentary consultation. I'll be there for you, looking out for your best interests. Again, that number is 833-414-7233.
See you next week.